Hello, my name is Bob Iannacco, and I'm the administrator of Whittier Rehabilitation Hospital. I welcome you to our facility and hope you find this video informative. Our visiting hours are 12 noon to 8 p.m. every day. However, we can be flexible if these times do not suit your needs. We ask that if you are coming at a time other than normal visiting hours, you arrange this through your case manager, nursing supervisor, or therapist. Whittier Way is a simulated community that is used to retrain our patients and prepare them for their discharge home. Our aquatics program has two different pools. The larger pool, which is most often used, has a temperature that averages 92 degrees and has an underwater treadmill. The small pool is used for those patients that cannot tolerate a higher temperature and is at 82 degrees. Transferring in and out of a car can be one of the most difficult tasks for a patient, so we are equipped with a full-size car so that patients can work on this with their physical or occupational therapist. Whittier Way also has a ramp and a curb so that patients are comfortable walking on uneven surfaces, and even have a putting green for those patients that want to return to the golf course. You can also practice shopping in a simulated market to work on reaching and balance skills while pushing a shopping cart and management of money at a checkout.
Hello, I'm Dr. Paul Liguori. I'm the medical director here at Whittier Rehab Hospital. What rehab medicine does is take care of the individual after usually a disabling injury or illness. We like to coin ourselves as the quality of life specialists. We have pulmonary consultants who are lung specialists, we have kidney specialists, we have psychiatry, cardiology, neurology, and a host of other specialty consultants. So we really focus on the individual and family around them, and not only treat their medical conditions they have, but how those conditions affect their lives and day-to-day function. You'll be followed by a rehab doctor as well, and your rehab doctor or physiatrist will oversee your rehab and therapy and will be in constant communication with the rest of the treatment team here, along with your medicine doctors. There will be an overnight physician on call. There'll be a physician in-house that will be present to handle any medical issues you might have overnight. On the weekends, there are two physicians rounding, so you'll be followed by a physician daily while here. If there's an outside physician that you'd rather see or wants to see you, then we'll facilitate a transfer to and from that appointment. Please let us know about any questions or concerns that you have. As soon as we know about any issues or questions or concerns, we can address them with you.
Hi, my name is Jennifer Sprague and I'm the Director of Nursing here at Whittier Rehab Hospital. We have developed our staff to provide patient and family-centered care with a focus on safety. Our nurses have specialized training and certifications in rehabilitation techniques, advanced life support, infusion therapy, wound care, diabetes, and infection control. We provide ongoing education to our staff, which reflects our commitment to recruit and retain some of the most skilled clinicians in the Merrimack Valley. You can expect our staff to greet you and inform you of their name and title with each and every interaction. We understand there are many individuals involved in your care, so we have implemented a dress code to assist you with identifying the different members of our staff. Our nurses are dressed in navy and white, and our nursing assistants in all navy. Our respiratory therapists are dressed in green. We recognize there are many questions you may have now and as you move forward through this phase of your recovery. And again, welcome to Whittier.
Hi, I'm Lori Faust-Lemire, and I'm the Director of Rehab Services here at Whittier. Physical therapy will focus on your endurance, strength, transfers, and mobility, such as walking. PT uses functional movement to promote health and well-being. Your treatment sessions may include lifting weights, challenging seated or standing balance activities, walking with an assistive device, and practicing safe and effective transfer techniques. OT helps you participate in activities you want and need to do through the use of therapeutic everyday tasks, including dressing and bathing. An occupational therapy session may integrate therapeutic exercise, ADLs, which is dressing and bathing techniques, cooking, laundry, and money management. Speech-language pathologists assess, diagnose, treat, and help to prevent disorders related to speech, language, cognitive communication, voice, swallowing, and fluency. Speech-language pathologists use special instruments and assessment tools, including standardized tests, to analyze and diagnose the nature and extent of impairments. Our therapeutic recreation services are very unique, where we address leisure pursuits, provide therapeutic massage, and animal-facilitated therapy. During animal-facilitated therapy, you may work on brushing the dog with your weak arm and hand, walk the dog, and communicate with the dog by offering him treats.
I'm Susan Frasca, Director of Case Management. Welcome to Whittier.
Every patient admitted to Whittier will have a case manager assigned to them. Case management is a collaborative process of assessment, planning, facilitation, and advocacy for options and services to meet an individual's healthcare needs. Case managers are integral to successful transitions of care to and from the various healthcare providers you may encounter. They help to facilitate communication among everyone involved, including you and your loved ones. Case management nurses serve as your voice in the healthcare system. Our case managers will work with you to determine what is important to you and what your goals are. They will be able to offer you options regarding services available in your community and help you decide what would be the most effective way to reach your healthcare goals.
Hi, I'm Maureen Mulcahy, the Supervisor for Respiratory Services.
Whittier employs licensed respiratory therapists 24 hours a day, 7 days a week. The respiratory therapy team will be involved in your daily care, helping to educate you on the best choices and therapies for your recovery, including oxygen, nebulizer therapies, home ventilator management, CPAP, BiPAP machines, airway clearance devices, and tracheostomy care. Respiratory therapy, helping you breathe easier.
Hi, I'm Dr. Stephen Boy, and I'm a psychologist here at Whittier Rehabilitation Hospital. I have learned a lot from my patients at Whittier during the past 25 years. People usually find themselves here after experiencing a serious medical problem that was often frightening and traumatic for both the patient and their family. They have often gone from being independent to being in an environment where there are many rules. The more people have been accustomed to being independent and in control, the harder it may be to become a patient. While it may feel as a patient that you have lost power and control, the goal of rehabilitation is to restore you to your highest level of independence. In 25 years, I have seen thousands of patients go from feeling a complete loss of control to returning home to their prior independent lifestyles. If you are feeling anxiety and depression while a patient here, your doctor may recommend that I speak with you and even your spouse or family if you would like me to. Patients who are willing to talk about some of the frustrations in the hospital seem to adjust better and even recover more quickly.
Hi, I'm Kate Alsop, the dietitian here at Whittier. Nutrition is an important piece to your healing process. The kitchen offers meals and snacks throughout the day to meet the individual needs of our patients. If you are on a special diet or have concerns about what foods are best for you, the dietitian is available to meet with you and answer your questions.
Hi, my name is Joyce Willette, and I am the Customer Relations Coordinator here at Whittier. I am your patient advocate. I will greet you upon admission and check in with you throughout your stay to ensure that you are receiving the best care possible. If you have any questions about our services, or if there's anything I can do to make your stay more comfortable, please ask.